The presentation that follows is brought to you by the Robert Hendricks Young Hearts for Life Education Program. For more information on Young Hearts for Life programs, view our website or email youngheartsforlife@yh4l.org.
So let me say welcome and start first with who am I? My name is Dr. Marek. I'm a cardiologist. I've been practicing cardiology in this community for over 35 years. It's a frightening thought for me. I have a special interest in sports cardiology, and I am the founder and medical director of the Young Hearts for Life program, which you're going to hear something about. Thank you for taking the time from your very busy schedules. The weather is nice, and I appreciate your coming here to spend some time to learn about saving the lives of our community's most precious and most important resource, our young adults. The testimony of your being here, or your being here is a testimony to your dedication to the safety and concern for the young adults that the community entrusts to you. So thank you. I very much appreciate that. Why are we here? We're here because of the support of a new program. It's the Robert Hendricks Young Hearts for Life Education Program. Robert Hendricks, let me get my notes here, I'm sorry. Was a devoted and passionate member of our Young Hearts for Life Advisory Board. He spent his entire business career in the field of finance and focused on mentoring and teaching colleagues and other members of the business community. Sadly, Bob died suddenly in 2017. In honor of his commitment and devotion to Young Hearts for Life and to his role as a teacher and mentor, we established the Robert E. Hendricks Young Hearts for Life Education Program. The mission of this program is to raise awareness of sudden cardiac death in young adults through education of the public and medical professionals. Bob believed, and he told me many times, that saving the life of one person makes the Young Hearts for Life screening program worthwhile. We believe that by educating the community, we can save many more lives in his name. So this program is just the first in the series that are dedicated to educating the community. A truly great mentor is hard to find, difficult to part with, and impossible to forget. So thank you, Bob. Bob's wife is here in the audience, and so I'd like you to join me in giving her a warm welcome. Thank you, Kay. So some of you are familiar with Young Hearts Life, some are not, so I'm just going to give you a brief background so we all have the same starting point. This program started in 2006, and our mission was to provide free ECG screenings to young adults. The idea was to identify those young adults who had silent, unrecognized, potentially life-threatening cardiac conditions and get them treatment before it could lead to catastrophe. Our model is what made us a success. We train community volunteers, usually the parents, on how to do the electrocardiograms on these young adults. This program has been very successful. I always felt that if you know how to use your cell phone, I could teach you how to do an EKG. And this program, the way we do it with volunteers, has been demonstrated with a peer-reviewed journal article showing that we can get a quality of ECG as good as or better than what you would get in your local health community program, hospitals or doctor's offices. With this program, we've done over 200,000 ECGs. I didn't wake up one day hoping to do the most ECGs in the world for this program. I had a day job. It's just that the model works so well and the dedicated community volunteers make this a success. This is the largest program in the country, and it may be the largest program in the galaxy. We're not sure yet. We're still checking on that. But recently, I realized that screening isn't enough. Our focus has broadened from just screening to the bigger picture of saving lives. With screening, we can identify about 70% of those young adults who are at risk for sudden death. Well, what about the 30% that escape our detection? What are we going to do for those? And that's why we're having this lecture tonight. So regarding this broader focus, how well are you, as representatives of schools, prepared? And I'm going to sort of introduce this topic with this video. Now, if you notice in the lower left-hand corner, there's a player down. You can take out your cell phones, go to the timer, and start the timer now, because this will be important going forward. Or you just could count in your mind about what's happening here. Start counting. This is still real time. Notice the CPR. Let's just walk across the court. Let's get a towel because that's what he needs. Now that's the athletic trainer that walked across. So I'm going to save you the agony. It goes on for another couple minutes. It was at least 4 minutes, and they're wheeling him off the court and still not doing CPR. But I want you to watch this again and pay attention to the coach when he goes out there. What does he do? Pushes someone out of the way, and he takes over. The athletic trainer comes and has an AED and shoves it in front of the coach. Who's in charge? Coach. So this was an epic fail. Zeke Upshaw, and this was just a couple weeks ago, had a cardiac arrest. Several days later, he was pronounced dead in the hospital with brain death. And so that's an epic failure. Now, you think this only happens in the big leagues? If this is only for the professional athletes? Well, think again. Start with Lauren Lehman. She was at high school. She was at drill team practice. She collapsed. CPR wasn't done. An AED was available. It wasn't used. Lauren died. Wes Leonard. You may remember this gentleman reached national news. He made the winning basket in the conference finals and then collapsed. He was laying on the ground. Everyone thought he had a heat stroke. This was in the middle of the winter. They ran over to the concession stand and asked the person who was volunteering there to get some ice. And it was a nurse. And she comes over there with the ice and she says, "Oh my God, this young man's in cardiac arrest." She says, "Call 911, get an AED," and she starts doing CPR. The people who were from the facility say AED. They go to the equipment room, move some stuff around, find an AED, bring it over there, put it on Wes Leonard, and the batteries were dead. Wes Leonard died. Jake West was at football practice, and Jake collapsed, and the details are sketchy, but they did go to get an AED. They brought it, applied it to Jake. the batteries were dead. Jake died. Stop and think, could this be me? If you're a coach, think about the consequences, the publicity, the liability, and your conscience for the rest of your life. Now, if you don't think there's going to be publicity, this is what's happening all the time. Cell phones are out, iPads are out. Whether it's a violent episode or whether it's an accident, someone is always taking a picture. Don't kid yourself. It will be recorded. It'll be on the news. It'll certainly be on YouTube. This phenomena even has a name. It's called the bystander syndrome. So instead of getting over there and actually doing something to help a victim or something, they'd rather record it for posterity. What about the liability? This is a scene from an Italian soccer player who collapsed during a game. His name was Morosini. No CPR was done. The ambulance could not get into the stadium. They finally got the ambulance in there, put him on a stretcher, wheel him out, never doing CPR. And the doctors who were responsible for taking care of him on the field were found guilty of manslaughter and sentenced to a year in prison. So hopefully I have your attention. So let's move the emotion out of the side and talk about the facts. There are 4 facts to consider. First, what is the incidence of this situation? Do we need to really be concerned about this? What's the likelihood of survival if we do things right, if we don't do things right? What is our state of preparation at the schools for dealing with one of these things? And what are the obstacles to successfully treating one of these situations? So the incidence, approximately 3,000 young adults die each year of sudden cardiac death. And a good number of those die during physical activity, usually at school or at a game. We don't know the exact number because there is no registry. We're moving forward to having a registry for this. So this number may be an underestimate, and many experts believe that it probably is. This statistic, based on a study done at high schools, a prospective study, showed that 1 of 70 high schools will have a sudden cardiac arrest incident in the next year. And half the victims are students. The other half are staff, coaches, referees, and so on. So there's a selfish interest in making sure that we're prepared for this. If you think that this just happens in the big leagues, this was a study that looked, and you could see that most of the cardiac arrests were in high school students. What about the survival? Well, it depends, and in large part, it depends on you and how you're prepared. So this was a study in high school students at high schools where they had an AED program. And if you'll note that the student athletes, they had an 89% successful resuscitation rate, really good numbers. But these were schools who were prepared. That's what can be achieved. This is another study that was just a registry of schools of all ranges, middle school to college. And you can see that the number was bigger. There were 132 victims in this. And the overall survival, you notice, was 48%. That's because the schools aren't prepared. And why is that the case? Well, this is a report from sudden cardiac arrest in the community. And you will notice, if my pointer works, that as you go from a situation where it's just paramedics, EMS, bystander CPR, bystander with AED, and AED with a shock, that the resuscitation rate goes up significantly. Why is that the case? It's because every second counts. If you look at this graph, it compares the success of resuscitation with the time. And the chance of a successful resuscitation drops 7 to 10% every minute. Seconds really do count. This is one of those few situations in medicine where that's the case. What about preparation? Well, in general, how well prepared are the schools? Once again, it depends. The Corey Stringer Institute from Connecticut did a survey about how well the schools were prepared for dealing with major life-threatening emergencies, the big ones being head trauma and cardiac arrest. And these were the statistics. North Carolina did the best. They were about 79%, 76%. Illinois is down there about 53%. And remember, this is just the policies that they have. We all know about policies. There's a spirit of law and there's a letter of the law. And are we really going to be following the spirit of the law? What are the obstacles to successful resuscitation? Well, first of all, it's not recognizing that it is a sudden cardiac arrest when someone goes down, sort of like what happened to poor Zeke Upshaw. And I'm going to try this, so bear with me. I hope this works. There's a short video here that I hope I can get to play. Now, I want you to watch this poor player, Mark Vivian Foe. Look at his abdomen. Looks like he's still breathing. And you'll notice that no one was really doing CPR on him. And you can see the standard look of someone in cardiac arrest, which you'll see in a few seconds here. Eyes rolled back, glassy-eyed. Still some agonal respirations. That's what they call those respirations. There were other things that happened. There was a recent article in the medical literature about how often the people on the field do this. They try and prevent the victim from swallowing their tongue. I have to tell you, I've tried to swallow my tongue. I just can't do it, yet this is done all the time. They have their fingers in their mouth. In fact, in this study, they had numerous examples. These were famous situations where the victim actually died because they spent more time trying to prevent them from swallowing their tongue instead of doing what needed to be done. That was recognizing that it was a cardiac arrest and performing what needed to be performed. So there are fullers, and these fullers are agonal breathing. This is a situation where it appears that the person is still breathing, but it's ineffectual breathing. That should not be a reason to not suspect sudden cardiac arrest. Seizure-like activity occurs in about 50% of these victims. And if any of you have seen the video of Hank Gathers, who had a cardiac arrest in 1991, and it was a televised game, and it's on the internet, he actually sits up a few times and goes back down. This should not be anything to deter you from determining that this is a sudden cardiac arrest. Eyes rolled back like on Mark Vivian Foe. And so the key is that if a player goes down without contact, assume a cardiac arrest and activate the chain of survival. Now, I'm going to say this again because this is probably the most important thing from tonight. If a player goes down without contact, assume cardiac arrest and activate the chain of survival. Don't try and check a pulse or something like that. Just get the chain going. The other obstacles is that schools and institutions don't have a plan, or they're not prepared. And this leads to chaos, uncertainty, and fear. This is the picture of the situation with Morosini. Look at the faces there. These are people who really don't know what to do in this situation. So Franklin said, by failing to prepare, you're preparing to fail. So the question is, what's a concerned coach, nurse, teacher supposed to do to try and prevent these tragedies? Well, you're all educators, and preparation through education is less costly than learning through tragedy. And so there's what I call the alphabet soup of preparation: CPR, AEDs, and EAP, CERP. And these are terms that refer to putting it all together, and I'm going to explain these one by one. Now, the American Heart Association, when they talk about CPR, has this great concept called the chain of survival. This is a chain of survival. It begins with recognition of cardiac arrest, immediate CPR, early defibrillation, and then advanced cardiac life support with EMS, and then treatment in the hospital. The problem is that this whole chain, as cool as it is, doesn't work unless someone actually recognizes that someone's in cardiac arrest and makes a decision that they should do something. And so that's where all this falls down. Now, it's an Illinois state law that high school students be trained in CPR. This is named after Lori Lehman, who I mentioned earlier. Her father worked diligently to get this law passed. The question I ask is, how well is it being followed? I don't think we know, but you in the audience know how well this is being done in your schools. Are they getting any CPR training? Some CPR training is better than no CPR training. Bad CPR is better than no CPR. It should be done. The law also states that it talks about teachers and coaches. And in the strong language that our legislators are accustomed to using, they say school boards are urged to encourage. That's really strong. Their teachers and other school personnel who coach school athletic programs and other extracurricular activities to blah, 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 learn and so on. Basically, to learn CPR. What about the coaches? Well, they are key in my estimation. Look what happened to Zeke Upshaw. The coach is out there, and he is the de facto leader on the field. No one is going to tell him what to do, certainly not a player. And that the athletic trainer came out with the AED. She knew what to do. She brought it to the coach. The coach countermanded her. So the coach needs to know what to do because everyone looks to the coach for direction. Now, there are states where CPR training is mandatory for the coaches. Red equals mandatory, and you'll see in the middle there that Illinois doesn't make it mandatory for the coaches. Lori Lehman might have been a different outcome. In 2008, she was in the gym at her school practicing with the rest of the dance team when she collapsed and went into cardiac arrest. While an AED was available, they were following the letter of the law that they had an AED. It wasn't used. And while CPR was eventually administered, it was not sufficient. By the time she arrived, it was too late and she died. And so it was in her name that this law was eventually signed in 2014. Now, our neighbors to the north in Wisconsin, the coach requirements beginning in 2017-2018 school year, all paid coaches shall be certified and will maintain certification in first aid, CPR, and AED operation. That's something that I think we should have. Because I think that knowing CPR is just part of being a good citizen. And from my standpoint, I want everyone to learn CPR because I may be the person that goes down. And this is the reason why the coaches should want it as well, and the rest of us. What about AEDs? The question is, do you have enough at your school? Are they properly located? They have to be less than 3 minutes away. And the school campuses are huge. I remember going to the schools, trying to figure out where the soccer field is. I drive around for minutes. And that's driving around. Can you get the AED there in time? Are they properly maintained? Are they charged? Are the pads still good? Remember what happened to Wes Leonard that I described earlier and Jake West. They might have survived had the AED been properly maintained. So who has that task at the schools? Has it been delegated to someone doing it? Appropriation and planning. I mentioned EAP and CERP. This stands for Emergency Action Planning, and it's just another name for it, CERP, Cardiac Emergency Response Plans. What's in one of these plans? Well, there are many templates that are out there in literature about what to do, and they're from many organizations. So for those of you who are familiar with this area of sudden cardiac arrest in young adults, there's Parent Heart Watch, Project Adam, the SADS Foundation, which is a Sudden Arrhythmic Death Syndrome Foundation, and they're all based on the CERP that was put together by the AHA in 2013, and they just put their own names on it. But since there's so many of them, that means there's no perfect one, and not everyone is using all of them, and that makes sense to me because all schools are different. These things have to be modified to suit the individual needs. Now, there are some key elements to these CERP programs. CPR training for key individuals, and for me, that means the people who are there when they're working out. Appropriate number of AEDs. You can't have a big school and have just one AED. And they have to have appropriate access. They have to be available there for less than 3 minutes. Why? Well, you'll recall from that chart I showed about the chance of survival from cardiac arrest. Let's just cover up the first 3 minutes, and you can see that the survival rate goes down to about 60%. And you saw that in the schools earlier that have an AED program, you could get an 89% survival rate. We shouldn't accept less. You need to coordinate with the local EMS. Why do you have to do that? You just call them and they appear, right? Well, this was an article that was in Reuters. It was a medical article about ambulance wait times. And the average waiting time in urban areas was 7 minutes, in suburban areas just under 8 minutes, and in rural areas just under 15 minutes. This was an article about a poor girl who died after an ambulance delay, and there was an inquest going on. And I thought these excerpts would be of interest. The first aiders called an ambulance immediately, but a chaotic rescue attempt meant that the paramedics did not reach her for more than 30 minutes. She's dead. Or worse, she survives and is brain dead. They could not find the correct gates at the park, only to discover it was locked. Organizers wrongly believed the ambulance service would have a key. It's this person's fault. And so coordinating with the EMS is important. And at this situation, although the provision of first aid for the event had been considered, little or no thought had been given to what should happen if an ambulance needed to be called. This was the same situation with Morosini. The ambulance couldn't get in because the roof was too low. So the chance of survival, again, this is what happens when we wait for the best situation of paramedics getting there in about 7 to 8 minutes. The survival rate goes way down. Let's look at this another way. This is school bringing AED and getting resuscitation done in less than 3 minutes. Survival rate about 75%. But if you wait for the paramedics, the survival rate is under 20%. School, EMS. What's the difference? I think you get the point. Other elements for the SERP is communication plan during an event. And so this is a situation where there are people key along the course to direct the paramedics to where they're supposed to go. This all has to be thought out ahead of time and can't be done in a chaotic way once an emergency occurs. Drilling is what gets this work. Periodic drills need to be done. Jennifer Shea from Michigan states that we have multiple fire drills each year in a school, and the last time a child died in the school in Michigan because of a fire was in 1927. And yet we're not doing drills for CPR. There are other elements to these SERPs, establishing a team, appointing a team leader, developing a written plan. These should all be modified for the local environment of the school. So if you're not prepared, this is how you may feel when the questions fly after an event. And you don't want to be answering that to a news person. So, action items for you. Do you have a plan? Are the key people in your institution trained in CPR, the ones who are the de facto leaders in the field? Is your plan reviewed and drilled periodically? How you can help us? We're looking for people from the schools because I'm a healthcare provider. I know how to deal with emergencies. You're bridging that situation. You know the school environment, and so we'd like to help develop a better emergency action plans for you. And how we can help is we're going to be developing a program where we would designate a school, a Young Hearts for Life certified cardiac safe school, promoting your school on the website, and for the schools that first do this, even providing an AED. Stay tuned. We're going to hear more about this in the future. But the last thing you have to do is plan. You have to do something because the life you save, particularly if you're a coach, may be your own. And just let me remind you, 50% of the individuals who have a cardiac arrest at the school are the staff. So to nail it home again, remember the protocol to follow. This is the universal response to the collapsed athlete, to make it simple. If there's a non-traumatic collapse and the athlete is unresponsive, assume that it's a sudden cardiac arrest. Don't get distracted by the fullers, the agonal respirations, seizure-like activity, the eyes open and rolled back, or trying to feel for a pulse, because they're darn hard to feel even by the most experienced hands in an emergency situation. And what you do then is you call 911, you immediately begin CPR, and you have someone get the AED. And you apply it, and the AED, they're idiot-proof. They'll take you through what needs to be done. So that's all the comments I have to make about this situation. What I'd like to do now is introduce our next speaker. His name is Mike Papali. Let me read some things about Mike so I don't screw it up. Mike is currently serving as a president of In a Heartbeat Foundation. Mike is a sudden cardiac arrest survivor. In 2006, he went into sudden cardiac arrest and was very fortunate to survive. He served as a volunteer and spokesperson for many national organizations and has lobbied for laws to try and improve CPR and AED availability. Mike is passionate about spreading the awareness of sudden cardiac arrest as well as the importance of CPR and AEDs. I heard Mike speak at a course on sudden cardiac arrest in athletes in Florida, and he gave a very compelling presentation. And so without further ado, Mike. There you go. Thank you.
Well, first of all, thank you very much to Dr. Marek and his wife, Kathy, for inviting me to speak to you all today. It's really an honor to be out here and to be able to share my story and hopefully kind of give you an idea of some things I've been through. So like Dr. Marek said, I met him at a conference down in Florida, and you know, when he introduced himself to me, he told me about his organization, and of course the first thing I did when I got back to my hotel room was Google it and look up and read information about it. And I know you've heard this before, but what you do is amazing. It's really incredible. And as someone that's, yeah, seriously, for someone that's, you know, I am a cardiac arrest survivor, but I'm fairly new at this whole world of trying to prevent death from sudden cardiac arrest. And what you've done has been truly an inspiration to me, and I hope someday I can have an impact like you've had. So thank you for, again, having me. And what I'm going to do in the next 25 minutes or so is kind of talk to you about my journey from sudden cardiac arrest survivor to being diagnosed with hypertrophic cardiomyopathy to having an implanted defibrillator to kind of just living my life and what I've done and different obstacles I've come across and kind of where I am now. So, you know, I'll say this before I start. I am totally open about everything that I've gone through in my life. So at the end or afterwards, if people stick around, if you have questions for me about things I don't talk about, please feel free to ask. I am open to talking about anything. So when I was growing up, I was your typical teenager, and when I was 13, 14 years old, I was training at a very high level to hopefully play college basketball. That was my dream and my goal in my life, to play college basketball. And I didn't show any symptoms. There was never a reason for my pediatrician or my parents to get my heart tested. You know, I didn't have chest pain, no shortness of breath, never passed out when I was working out, nothing out of the ordinary. So I never got an EKG until after my cardiac arrest. But, you know, when I was 17 years old, between my junior and senior year of high school, I was playing for what they call an AAU basketball team, and I was traveling, you know, all up and down the Northeast. I'm in Connecticut, and once a year we'd go play in nationals. And during that year, that was the year I was starting to get recruited to play college basketball. So we would go to these tournaments, and coaches would be on the sideline, and they'd be watching us play. And if they liked you, when you got home, they would send letters in the mail. They'd call you. They'd call your parents. They'd email you, and that started to happen for me. So it was pretty cool, like at 17, to kind of feel like this dream I had for my life to be a college basketball player was starting to come true. And, you know, again, coaches were calling, texting, emailing. And that summer, I'll just take you back a little bit. My dad, he runs a basketball camp in our hometown. And it was a huge part of our lives. And my brother and I and all our friends would go to this camp every year. And once we became too old to attend the camp, we became counselors at the camp. So that particular summer, again, between my junior and senior year, my brother and I, we were both counselors at this camp. And I was 17 years old, he was 13, and we decided, the camp was being held that year at the end of August, that on Wednesday night, we decided the next morning we were going to wake up early and work out before the camp started. So we could hang out after camp ended. We didn't have to go do our workout after. So we woke up the next morning, August 24th, 2006, and one of our friends that would put us through these basketball workouts came and picked us up, drove us to a school in town, and we went through a basketball workout for about an hour and a half. It was high intensity, nothing out of the ordinary, and again, everything was normal. It was about 8 a.m., and he drove us to the Wallingford Parks and Recreation Center where the camp was being held. And I walked in, said hi to my dad, I changed my shirt, and I ordered lunch, and that's the last thing I remember from that day. So about 2.5 hours later at 10:30, and again, I did a whole bunch of stuff between 8 and 10:30 that I still, to this day, don't remember. But I was sitting on the bleachers next to my friend. My brother was in the gym, reffing the game that was going on, and I just slumped forward and went into cardiac arrest. And unfortunately for me, and as you all know, and like Dr. Marek talked about, two things have to happen. Recognition, and then I have to get immediate CPR, and I have to get shocked by a defibrillator. So we had a trainer working the camp, and the trainer came up to me, and she didn't recognize that I was in cardiac arrest. I was agonal gasping. So she looked at me and didn't do anything. And she thought I was fine. And for whatever reason, this Park and Rec Center that was hosting tons of camps throughout the summer, workout programs for adults, men's basketball leagues, people of all ages are served by this Park and Recreation Center, and they did not have a defibrillator in their building. So those two factors made my odds to survive very slim. I was lucky that someone was smart enough to call 911. And in the building next door, there was a man sitting at his desk, and he was a volunteer EMT. And when 911 was called, he had his pager on, and he got the call on his pager. He recognized the address, and he wandered over because the 911 call didn't come through the right way. And I don't know the different codes that EMS gets, but the way he's described it to me is he wandered over expecting to see maybe like a broken arm. Whoever called 911 didn't specify that there was an unconscious teenager on the ground. And when he opened the door, he found me, turning blue, and again, taking these agonal gasps. And this man provided CPR, and he saved my life, saved my brain, and he kept me alive until an ambulance arrived, and the EMTs ran in with a defibrillator and shocked my heart back to a normal rhythm. So I was rushed off to a hospital, and then eventually to another hospital, and I was unconscious for a couple days. And once I was able to wake up, they tried explaining to my parents, like, your son has something wrong with his heart. And my parents aren't medical professionals. And they basically tried to fight the doctor on it. They were like, no, he doesn't. Like, look at him. He's 17. He's healthy. Doesn't drink, doesn't smoke. Like, he's in shape. There's no way my son has something wrong with his heart. And as a family, we were very, very, very ignorant to the fact that children and teenagers can't have issues with their heart. But they put me through, a ton of tests, and they diagnosed me with hypertrophic cardiomyopathy, which you all know is in a large heart muscle. So it's been pretty cool for me to tell people I have a big heart for the last 11 years. It's been a great pickup line. I actually never have done that, but never used my big heart. But, they decided to implant a defibrillator in my chest, and that was the end of my basketball career. So I spent like 2 weeks in the hospital, whole whirlwind of like words I've never heard before, like cardiac arrest and hypertrophic cardiomyopathy. And I finally went home, and I'll never forget this. I walked in, we went through our driveway, parked the car in the garage, I walked into our basement, and it hit me like, okay, my life's about to change right now. And I had no idea to what extent and where my life was going to go, but I knew it was going to change. So coming home from the hospital, like being in the hospital is never fun, right? The hospital's not a fun place to be. But One of the advantages of being in the hospital is that anytime you're uncomfortable about something, anytime you're nervous, anytime you have a question, anytime your machine starts beeping, you can hit a button and a doctor or a nurse walks in and they help you out, and it's great. But when I went home, I didn't have that. And my parents, again, were not medical professionals. So something that helped us early on in this whole, figuring out how to navigate life with this condition was empowering ourselves with knowledge. So my mom is a mom, and she was like, research this condition to like crazy. And one of the first things we did was get CPR and AED training for our family. So that helped us knowing that if something happened to me again, my family was empowered to help. And the second thing for me that I had to get used to was I had this new piece of metal in my chest. And when I first got home from the hospital, my doctors, they didn't want me lifting my arm. I'm left-handed, and my ICD, it's in a different place now, but it used to sit right here on the left side of my chest. And they didn't, I had to let it settle in. I was in a sling. And when I finally got the sling off, my doctor said I could try moving around, getting the range of motion back. I happened to be in a gym with my dad, and I took a basketball, and I shot it. And it felt normal, except the ball went about 10 feet and didn't even come close to going in the basket. And again, I'll never forget this because I was like, this is my life now. Like, I'll never be able to shoot a basketball again. And getting used to this ICD and learning how to trust it and, going past the fears of inappropriate shocks. I was walking, I've been in Chicago for a couple days now, and I was walking on the street, and there was a horse out on the street, and I remember the doctor first told me, he said, if you get shocked, it's similar to getting, the feeling is like getting kicked in the chest by a horse. And that triggered that when I saw that. I was like, that's not a fun feeling to have. So I was scared, like, at first. I had, again, this new piece of metal in me. Is it going to save my life? If I go down, is this thing going to work? It's a machine. So, as time went on, like, I just learned how to trust it. I don't even think about my ICD anymore, unless I'm talking about it like I am right now, or I'm talking to somebody about it. It's just a part of me. I have 100% trust in it. I have no fear that it's going to shock if it doesn't need to. I completely believe that if it does need to shock, it will, and it's just a part of my life. But that was a huge adaptation for me. It was very hard to kind of get that feeling and be able to trust it. Losing basketball for me was really, really hard. Like I said, my goal in my life was to play basketball in college. And I'll never forget the day my doctor came in and she said to me, Mike, I've got good and bad news for you. The good news is you went into cardiac arrest, you survived. Based on your circumstances, no CPR, no AED, your chance to survive are 1 in a million. But the bad news is you're never going to play competitive basketball again. So again, I'm 17, sitting there like, okay, obviously I feel lucky and blessed and happy that I survived, but I also had these feelings of like anger and sadness and depression and frustration. Like the one dream, that I had got taken from me in 1 second, and there was nothing I could do about it. Like I was never going to play basketball again. And that was really hard. But I have this conversation with people a lot. I think that, and I would never wish anybody to go into cardiac arrest because it's a very traumatic thing for a family. But I think it was easier for me to come to terms with the fact that I could never play basketball again because I had my cardiac arrest. Because I was on that point of like life and death. And I think it's much harder for somebody that gets an EKG and goes through a test and gets diagnosed, and maybe the disease hasn't affected them to the extent that it's affected me, and the doctor says you can't play basketball anymore. I think that's a lot harder to come to terms with mentally. And I say this whenever I speak. For anybody that I might be able to help guide and help understand how serious these conditions are and help realize that there's more to life than basketball, or a sport, or whatever it is that they do that got taken from them, I would love to help anybody who here that that knows somebody or has a patient or a student that they think that I could help them. So I have business cards, and I'd be happy to pass them out. So that was hard, and a couple things that helped me with that were, number one, I didn't get to play basketball my senior year, but my coach let me be involved. He let me, come to practice, come to games, sit on the bench, kind of be like a student coach. When I went to college, I was a student manager for the basketball team for 4 years. That was an awesome experience. I ended up coaching college basketball for 6 years, and as athletes, we're all very, very competitive. So coaching was able, a way for me to kind of keep that competitive drive. Another thing that happened, when you're a high school athlete, you can eat whatever you want and never gain weight. And so I was, and I would burn so many calories every day. I could eat McDonald's, I could go eat dessert with every meal, I could drink soda, and I would never gain weight. But when I had my cardiac arrest and I came home from the hospital, I was scared to get my heart rate up. I was scared to exercise. I was scared to sweat. I was scared to really do anything because I didn't want my ICD to shock. I didn't want to go into cardiac arrest again. I didn't want to do anything to kind of have this happen to me again. But one thing I wasn't afraid to do was keep eating. So naturally, I started to gain weight. And when I was going, I gained a ton of weight my senior year of high school. And I started to lose like a little bit of confidence in myself because I went from being this super fit athlete to now being overweight. And I wouldn't want to take my shirt off in front of my friends or change in the locker room before gym class. So I got to a point where I was like, okay, I have to figure out how to make my life and get this feeling of confidence back. Like I need to figure out how to get more fit again. So the first thing I did was I tried to figure out how to eat better. And, I started to cut things out of my diet, and I don't eat a perfect diet by any means. I ate like a whole deep dish pizza last night. But I eat, like I do things in moderation. This was like cutting out soda, cutting in. And the second half of that was learning how to work out. Like I had to learn how to eat healthy and eat better and learn how to work out. And again, I didn't want to work out because I didn't want to go into cardiac arrest again. I didn't want my defibrillator to shock me. So what I did was I went to cardiac rehab, and I hated it so much because I walked in the room and I was 17, and I was the youngest person in the room by 60 years. And, they put me on a treadmill, and they had me like walking on a treadmill. And at the time, I knew I could run probably like a couple miles because it wasn't too long after this happened. But they were starting me off slow, and I was lifting very lightweight, and I was like, is this really what my life's going to be, right? And like they had me jog one day, and it was like a miracle in the room. I was like, people are looking at me like I was like a pro athlete. But as much as I hated cardiac rehab, and it was frustrating to me, like cardiac rehab helped me. It helped me kind of experiment with working out and what I could do and what my limits were. And working out, in all honesty, for me has been, it'll be 12 years this year since my cardiac arrest. It has been a learning experience that has taken probably 10 or 11 years for me to figure out. And I'm in a great place with it now. But the one thing I'll say about myself and that's helped me, and I would say this to anybody, especially people that have a cardiac disease and are limited, is that I've come to terms with the fact that when I work out, it's about me, and it's not about anybody else. So like I mentioned, my younger brother doesn't have the condition. He gets tested every year, played Division I basketball, great athlete, trains at a super high level, and I work out with him once in a while. And I can't keep up with him, and that's okay to me. And I've come to terms, but it's not about him. Another one of my friends, I work with him, I coach with him. He played in the NBA for 8 years, played for the Bulls for a year, and I used to work out with him every day because we were coaching together. And I had no shot at keeping up with this guy, but what I'm getting at is I came to terms with the fact that it wasn't about him, it wasn't about my brother, it was about me and my workout and what I could do, and not trying to compare myself to other people. And that's really helped me kind of realize that, okay, I'm doing what I need to do for myself and not trying to compete and run as fast or lift as much weight as anybody else. So that's, kind of the 10 or 11 years that it's taken me to kind of get there and learn what to eat and how to work out. Is now I feel great. I work out every day and I eat, like I said, not a perfect diet, but a good diet. like I mentioned before, I coached college basketball for 6 years, and I would suggest anybody, if there's any, for anybody that loses a sport, that is the next best way to. And some people are like, I don't want to. If they lose basketball, they don't want to be around it. And it was hard for me at first, but coaching has given me that competitive drive that I had when I was an athlete, and I lost when I was an athlete. But it kept it in my life, and I would suggest, as hard as it is for anybody, I would suggest anybody to try it at some level. Whether it's I got to coach at the college level, high school level, young kids, it's just another way to stay involved in a game or a sport that you love. When I was coaching, I coached at a school called Quinnipiac University. It's right around Yale University. Nobody's ever heard of Quinnipiac, so it's right down the road from Yale. That's what I always tell people. It's like all the people that can't get into Yale go to Quinnipiac. But so 8 years post cardiac arrest, I was coaching there, and my ICD's battery needed to get changed. So I went in for this surgery, and the surgery is a pretty routine surgery. They just open the pocket where the device is, put in the new battery, and what they do is they test the device when you're in surgery. So they put your body into a cardiac arrest, and they wait to see if the device is going to kick in. And for whatever reason, when they did that, the device was only working on its maximum power. So I guess, and I don't know the terminology behind all this, but they tested at different powers to make sure, like, it's a machine. So if it's only working at its maximum power, God forbid it's working at not its maximum power, it's not going to save your life. And that's what was happening. So I came out of the surgery, and my doctor's like, I don't feel comfortable sending you home because this device will only work when it's at its maximum power. So we came up with a plan, and the next day they added a third wire on the side of my heart, on the side of my chest, and did the same thing. Went in for the surgery, put in the wire, and it worked perfectly. So they sent me home, and what I didn't know is during one of these two surgeries, I caught a bacterial infection in my body. But bizarrely enough, it didn't show itself for about a month. So I was out one night with some friends, and I was scratching my chest. And I was like, something's off. So when I went home, my chest was all puffy and red, and it didn't look right. And I went up to my doctor. They gave me some medication and went away right away. And then another month goes by, and we were getting ready for a road trip for basketball. And I was trying to sleep one night. I couldn't sleep. I was spiking like 103, 104 temperatures. And I called the doctor again. He's like, you need to come right away. The device is infected. We need to take it out. So the process for taking this device out is they have to use a laser to extract the leads. So it was not only the battery that had to come out, it was the leads that were directly touching my heart. And what they do is they prepare you for open heart surgery because there's a small chance that as they're doing this, the scar tissue around the leads could rip and your heart could bleed, and if you could potentially die in surgery. So I went in for the surgery, and with my luck, that ended up happening. So they had to perform emergency open heart surgery to save my life. And I'm not going to go into a ton of detail about the whole recovery, but basically what happened was they sent me home with a PICC line to flush out this infection, so I was administering medicine every night, and I had an external defibrillator. It was called a Zoll Life Vest, because they didn't want to put a new defibrillator in until the infection was out. So now it was time to, recover from the open heart surgery. But one of the things I want to talk about is relationships with heart disease and relationships with family, friends, boyfriend, girlfriend, husband, wife. The thing I'll say about that is at the time I was dating someone very seriously. And I'm not going to just talk about dating people, but I think it's really important for you to be completely honest with people in your life, people that are close to you, about the reality of your situation. Like, make sure people understand, like, it is a reality that, like, I could go into cardiac arrest again, and my friend, my family could be in the room, and they're going to have to do something to try to save my life. It's just reality. And it's not an easy conversation to have by any means, but in my opinion, it's an important conversation to have. Because I think, that people have to understand that, and they have to do what they need to do to be confident that if that does happen, that they can do something. And, and on the other side of that, I think it's important that not everybody handles situations different, the same way. Everybody's different. And the way I handle a situation with my girlfriend at the time was I handled it one way, she handled it another way. The way I handle it is different the way my mom handles it. It's different the way my brother handles it. It's different the way my friends handle it. But it's important, in my opinion, I don't practice what I preach here. I don't talk much about this with my family, but I think it's important to talk and be open and be honest and be real with people. Like, this is a reality. Like, this could happen, and this is what you're going to need to do. There's two more things I'm going to talk about. Number one, I talked about this briefly at the event in Florida, and people ask me this, and I don't like talking about it much, but people ask about drinking. And when I didn't drink till I turned 21 years old because I was scared to, but I drink socially, and I know every person with heart disease, it affects differently. It hasn't affected me. So that's all I'm really going to say about it, but people do ask. But the last thing I'm going to say is one of the biggest things that's helped me in my life, and I would encourage if anybody has a friend, a relative, or patient, student that has heart disease or has gone through something in their life, I think one of the greatest things we can do in life is make an impact. And I didn't really plan my life to go this way, but I wouldn't have it any other way. So I would encourage any person, if you have a cardiac arrest or if you're diagnosed with a condition, it kind of gives you an automatic passion for something. And not everybody's the same. Not everybody can come up here and talk and tell their story. Not everybody can do that. But getting involved has completely changed my life. It started when I was 17 years old. I hated speaking in front of people. Like, I was a super, super shy kid, really uncomfortably shy. And when I started talking and it just about my story and realizing the impact it could have on other people, it really changed my life. But again, not everybody's like that. But I would encourage anybody you know to get involved somehow, some way, because again, it's given me a serious, serious purpose in my life, and I wouldn't really have it any other way. So again, please, if I can help, I do have my own organization. We donate defibrillators. I'll tell you real quick about it. We've donated 41 defibrillators so far. We raised money and donated to hypertrophic cardiomyopathy research projects. So we've donated $15,000 for different research projects. I'm hoping there's a lot more to come. My goal is in Connecticut to host a screening someday. But if you think my story, or my organization can help you or someone you know in any way, I have a ton of business cards. Please get them from me and feel free to give out my information. So thank you again to Dr. Marek and Kathy and everybody for being here and inviting me.
The hour's growing late, and I'm going to wrap things up, but we'll be available to answer questions. Just want to give thanks then to everyone who helped make this evening work for us. My partners who allow me to devote this time and give me their support for what we're doing with Young Hearts for Life. It's a team effort. I want to thank our generous donors. Without their support, we couldn't do programs like this or the screenings and the other things that we do. I want to thank Edward Elmhurst Hospital, particularly Lee Goodson, who's helped us get this room and have a venue for doing this. They've been so supportive from the very beginning of Young Hearts for Life, and her in particular. And then I want to thank Mike for making a trek down here and sharing his personal story to give the human element to these things that we're talking about. It does affect real people. And finally, I want to thank the junior board members and the staff from Young Hearts for Life that helped me with doing all of this stuff. I apologize. I know that we had said that we would possibly get CEU hours for this. It's an incredibly bureaucratic process, and we were unable to do that. So I hope you find the time that you spent here worthwhile, even without the CEUs. As you noticed, we're videotaping this, and if I'm not mortified by how I look on the videotape, we would make this available for people from other schools where geographically or because of their schedule, they were unable to see it. I think this program has been blessed and inspired all along the way. Anytime I ran into a stumbling block, it seemed like there was going to be a solution. And this morning I picked up my calendar and was like a week behind and tearing off the sheets. And there was a message for us that I think is a message for all of us here. So the way to get started is to quit talking and begin doing. Walt Disney said this, so please go back to your schools, get started, stop talking, and reach out to us, and we'll try and help. Thank you, everyone.